Question number 1. A patient has deep vein thrombosis of the left lower extremity and is receiving heparin, it is the anticoagulant, through a continuous IV infusion into the peripheral vein. The patient has pneumonia and now require IV antibiotic every 6 hours. Each antibiotics infusion require 30 minutes for administration. To accomplish the correct administration of both medication, the nurse should plan what? The patient diagnosed deep vein thrombosis and pneumonia. Patient take IV anticoagulant heparin, now need IV antibiotics. What we could do? We use a separate IV insertion line to admit the antibiotics. We do not use the heparin line to give the antibiotics. We use separate lines to prevent drug-drug interaction. When assessment a patient who is receiving anticoagulant, a nurse should assess for epistaxis. So, assessment a patient who receiving anticoagulant. So, the side effect of anticoagulant, patient develop bleeding tendency, bleeding disorder. So, we should assess for nosebleed, we call epistaxis. We check for petechiae, ecchymosis, or any other bleeding tendency. Question 3, a nurse is caring for a patient who with a diagnosis of gout. Which of these laboratory bureau should the nurse expect to note in the patient? So anti-gout medication patient are taking. So what we should check? Most of the anti-gout medication like colchicine have a chance to probe stone formation or nephrotoxicity. So we have to check the renal function test, and I said stone formation, so we need to check uric acid level. Laboratory study need to figure out uric acid level. And uric acid level normally 8.6. 8.6, it is more than normal range. So we have to go for further management. Question 4, a patient taking anticoagulant warfarin has elevated the prothrombin time and also INR 4.5, international normalized ratio 4.5. The patient is scheduled for surgery. So the nurse anticipate in order for vitamin K. So when patient need to go for any major surgical operation, we should hold this medication at least 7 days. Also, patient is supposed to take vitamin K. Next question here. A patient is teaching, a nurse is teaching a patient who is taking colchicine. It is the anti-gout medication, treat for the gout. Which of these is the important instruct to include the teaching plan? Report hematuria to the physician. So after taking this medication, if patient have a hematuria, means blood mixed with blood, we have to talk to the healthcare provider. Question number 2, phase 1, a patient with deep vein thrombosis, deep and also right lower extremity prescribed the thrombolytic therapy. During administration of medication, the patient experiencing sudden increase the blood pressure and change in the level of consciousness. Which of these actions should the nurse take first? Anticoagulant or thrombolytic therapy, sudden decrease the blood pressure and level of consciousness. So we must stop this medication and we call for the healthcare provider. Next question, which of these manifestations should be most significant when assessment a patient who taking the diltiazem? So we have to check the heart rhythm and also blood pressure. So verapamil, diltiazem or other calcium channel blocker, before prescribe, we must check the heart rate and rhythm and also check the blood pressure. The nurse is teaching a patient about inhaled steroid such as flunisolide or fluticasone steroid inhaler. The nurse teaches the patient about action to take after taking a dose of these drugs. The patient should be instructed to raise the mouth with water. So steroid can cause candida. It is good to raise up the mouth after use this steroid. A patient starting that he does not understand why his chest pain occur when he is when he's resting, exercising, or sleeping. The patient asks how a calcium channel blocker is going to help. So a patient develop angina and patient take the calcium channel blocker like verapamil or diltiazem. Which of these is the best response by the nurse? Calcium channel blocker would help you form of angina by increasing cardiac oxygen supply. Next question, a nurse is providing discharge instruction to a patient with prescription for isoniazid. Isoniazid is anti-TB medication. Which of this statement indicate that the patient understand about the correct use of isoniazid? I must take medication for mouth if I am to get well. So usually the anti-TB drugs, we have to take 6 months or 12 months regimen. Most of the cases, patients stop the medication when sign and symptom of the disease disappear, but they must complete the courses of anti-TB drugs. So it means I must take the medication for the months if I am get well. The nurse is preparing to administer clopidogrel to the patient with coronary artery disease. The patient asks the nurse why I am getting this medication. So how clopidogrel help in case of heart disease? Clopidogrel will help prevent your blood from clotting in the artery. So it is anti-clot formation medication, prevent the clot formation. Question number 7, a patient is prescribed oral alendronate medication for osteoporosis. Which of this statement indicate that a patient need further instruction about this medication? Take this medication every 3 months. This is the important note we could educate our patient. Eldronate need to take every 3 months. A 72 years old patient of Asian descent is prescribed Eldronate following the result of a bone density study. What information should the nurse include in the patient teaching plan about this osteoporosis drug? Take it first things in the morning with a full glass of water.